Good afternoon, everyone. My name is Mackenzie Drazan, and I am the CEO and co-founder of MiResource, a platform designed to help match patients to the right mental health care for their individualized needs and preferences. My freshman year of university, I lost my sister Shelby to suicide. When Shelby first reached out for help, my family had no prior experience in mental health, and we had no idea where to look for a therapist. Shelby was struggling with an eating disorder, anxiety, and depression. And when we asked our pediatrician where we could find a therapist, she gave us a list of 3 therapists. The problem is that those therapists didn't specialize in all the areas that Shelby needed. We ran into the same problem when we went to the hospital. The hospital was unable to refer us to a residential program that met all of Shelby's needs. They could treat her anxiety and depression and suicidal thoughts, but they weren't able to treat her eating disorder. And we ended up back in the hospital again to treat just her eating disorder this time. We failed to find Shelby the right resources, but it wasn't from a lack of trying. The system was not able to help us find the right care for Shelby. I spent the next 2 years learning everything I could about why we weren't able to find Shelby the right care. Why wasn't the hospital able to help refer us when 1 in 4 Americans struggle with a mental health condition at some point in their life, and 50% of those struggle with not just one condition but multiple conditions like Shelby. What I learned is that in order to make a good match between patient and provider, there's so many variables you have to keep track of. That includes what insurance does the provider accept, what conditions do they treat, which modalities do they use to treat those conditions, and that information changes frequently with mental health providers, so it becomes extremely hard to keep track of lists of hundreds and even thousands of therapists, which is why hospitals aren't able to do this. They lack the infrastructure. MiResource helps provide this infrastructure to health institutions and university counseling centers to allow them to be able to search their list of therapists to find the right resource for their students and for their patients, no matter how diverse their needs are. MiResource is currently working with Duke University Counseling Center, Montclair State University Counseling Center, and James Madison University Counseling Center to match their students to the right mental health providers for their needs. MiResource has gained over $5,000 in revenue in the past few months since we launched this past May. In order to get to a place where we can help match anyone from anywhere to the right mental health therapist from the comfort of their own home, we are starting with university counseling centers so that we can populate our database with high-quality providers and test it in regional areas. We'll then move on to helping hospitals and insurance companies help match their patients to the right care for their individualized needs. We are extremely lucky to have an incredible team of people on our team. My co-founder, Gabriela Astorius, Jeremy Lang, our chief software engineer, Rob Rappley, our statistician, and an incredible board of advisors, including Dr. Helen Egger, who is the head of adolescent psychiatry at the NYU Lagoon Center. We are raising $100,000 to help scale up our setup process, as well as refine our marketing strategy so that we can help people like my sister find the right care before it's too late. Thank you so much.